name is Danielle Tallman, and thank you for attending my presentation. As physicians and practitioners, I know you have very busy schedules, but you also know that the care you give your patients is your number one priority. Today, I will be discussing a new treatment option for patients diagnosed with bacterial vaginosis. As clinicians, you hope to diagnose and treat BV cases with a full recovery. Many of you work with established patients receiving care, but many of you see patients in urgent and emergent situations where BV complicates medical care. In settings like the ER or urgent care, there is no guarantee that a woman diagnosed with BV has a primary care physician that they will follow up with, or that any follow-up care will occur at all. Unfortunately, many patients prefer to either use the internet to self-diagnose issues or rely on non-medical professionals for medical-grade treatments. As you may be aware, there are other conditions that are commonly mistaken for BV, or patients have personal aversions to seeing medical professionals. Many of the commonly prescribed drugs look familiar to you since these are common treatments for BV. When used in short-term cases, they can benefit women significantly. The issue arises when certain women have recurrent cases of BV. Research has shown that the long-term use of these antibiotics could lead to antimicrobial resistance and the potential for BV to become more chronic. Now, I am not here to tell you to stop using these drugs, but when you see recurrent BV cases in patients that you may be treating, there may be a new option for them. The drug I present to you today is called Prefapro. Prefapro is a registered prebiotic produced by ADM Deerland Probiotics and Enzymes and has currently had clinical trialing supporting gastrointestinal and gut health. Prefapro is a generally regarded as safe probiotic and bacteriophage therapeutic option that aims to rebalance the vaginal microbiome seen in BV. This treatment uses several bacteriophages that were used in previous studies to improve GI symptoms. They had positive interactions with mucosal barriers that generated phage-mediated immunity in those studies. Seeing that they were impactful in the GI mucosal barriers, this trial wants to shift its focus from GI mucosal inflammation to affected vaginal mucosa. If phage-mediated immunity could occur in women diagnosed with BV, the hypothesis is that the BV will be able to be cleared by the host immune system without the assistance of antibiotics and the side effects that are associated with them. For this clinical trial, I have provided the official listing of inclusion and exclusion criteria. Ideal candidates should be within the premenopausal adult age, not have any major medical history that could affect collection of samples or female anatomy, must not be pregnant, and should be able to regularly attend appointments. Even though I just showed you the inclusion and exclusion criteria, there are some things that could be completed as a pre-screening, which would help you know if your patient is applicable for this trial. Number one is that the vaginal gram stain analysis is consistent with a positive BV score via the Nugent score. There are many ways that hospitals, clinics, and labs may diagnose for bacterial vaginosis. For this study in particular, we standardize everything by using the same method of assessment. If your facilities do not use this method, or you cannot find out the method, that is okay. They will be tested upon approval to see if they do meet the scoring criteria. So, why would you consider this as another treatment? As I previously hinted at, some of the common treatments, when used repeatedly, could lose effectiveness over time, or potentially antimicrobial resistance. With Prefapro, It has shown positive GI benefits and helps reduce constipation, which sounds more like a positive rather than a negative. Typical antibiotics have unfortunate GI and gut irritations that can lead to diarrhea. Since this is not another antibiotic treatment, it will not negatively alter the vaginal or gut flora, and we anticipate less side effects for the patient when we are prepping this study. Currently, Prevopro is marketed for GI use, but with the potential benefits it could have for vaginal health, that is why we need you for recruitment. You have established care with patients and have the ability to monitor if the traditional treatments are effective. Since you meet with them, presumably during recurrent BV diagnoses, that is when you could establish if this trial could be of interest to them. Now to address some concerns. For the trial's efficacy, the drug has already been through phase 1 and 2 trialing with other studies, but mainly assessed GI-based targets. For this trial, we are not adjusting the current drug, but we are trying to explore if it has other uses in helping microbiome dysbiosis, as it did for the GI tract. For fair trialing, it is a double-blind placebo study. It is crucial that people enrolled in the study are educated that this is not a cure, but a potential alternative treatment. There may be confusion as why a drug for GI symptoms is now being used for BV, or what bacteriophages are. It is crucial that we educate the participants in terms that can be understood by them. We also want to select candidates that will enroll for the entirety of the trial. The risks for Prevopro have been thoroughly assessed, but a disclaimer of the course will be provided to participants. Now we know there will not be potential patients lining up at your office doors, but we want you to know that this trial is actively seeking applicants and you can help us out with this. To end my presentation, I just want to say that all of you have resources that I wish I could have. You have patient interactions in your practice. If you feel that someone could potentially benefit from this trial, if they have chronically struggled with BV or vaginal dysbiosis, I hope you will offer them this opportunity. Not only could this potentially help them out, it could give very beneficial information on the research and treatment of BV. This trial is also broadening our use of bacteriophage therapy. Our goal is to find alternatives to antibiotics that could damage healthy and beneficial vaginal flora. I hope you also see the benefits this trial could bring to your patients. Now that I've finished my presentation, I'm going to open the floor to any of you that have questions.